Medical students roll up their sleeves to reveal hands covered in flesh-melting acid. Someone is being sewn up inside out after an experimental operation goes wrong. And in another room, a demented doctor holds up a glass jar full of eyes like a collector of rare seashells. You're about to see the most insane medical treatments people actually survived. Viewer discretion is advised for this video, as some of this video may be offensive or disturbing. We, the makers of this video, in no way support or condone the actions of the subjects featured. Trepanning was an ancient surgical procedure where a hole was drilled into the skull. It was first performed as early as 6000 BCE during the Neolithic era. For centuries, its purpose was primarily to treat ailments such as headaches and epilepsy. The earliest documented evidence of trepanning comes from a Neolithic site in northern Iraq, dating back to around 6,700 years ago. During the Stone Age, it was thought that diseases were caused by evil spirits or malevolent demons. Trepanning was used as a form of treatment to allow these entities to escape from the body. This practice continued throughout history. Around 2500 BCE, the ancient Egyptians performed trepanning to cure painful disorders of the eye, ear, and nose. Surprisingly, many patients survived the procedure. Often the process was incredibly painful. In the Middle Ages, trepanning was still performed to treat various ailments, including mental illness. Many believed that by drilling a hole into the skull, they would release the evil spirits that were causing these conditions. However, this did not always work as planned, and sometimes had devastating consequences. One wrong move with the trepanning drill could end your life. Fortunately, one patient who survived this ordeal was the man known only as the Barberini patient, who lived in Rome around 800 AD. His story was recorded in a 19th century book titled L'Ospedale, or The Hospital, an account of the clinical and pathological observations made in the principal hospitals of Paris and Vienna during the years 1824 and 1825. Although he managed to survive the trepanning process, he sadly passed away soon after due to complications from the surgery. Today, trepanning is rarely used except in rare cases of traumatic brain injuries or tumors. Doctors stitch a woman's face inside out after botching her sex change operation. Doctors used to perform radical sex reassignment surgeries that went horribly wrong. They would cut off a woman's nose, lips, and ears to make them look more masculine. But the surgeries left their patients disfigured and traumatized. In 2003, a Brazilian trans man named Rodrigo de Castro went to see Dr. German Colosso to have his nose reshaped. But instead of correcting his nose, the plastic surgeon chopped off the bridge of his nose and stitched the sides together, turning the man's face inside out. Naturally, Rodrigo screamed in pain when the doctor accidentally cut through his nostrils, severing his sense of smell. Then the doctor tried to stitch the insides of Rodrigo's face outwards. This turned the man's face into a horrifying mess of flaps and ridges. But worst of all, the surgery left him blind in both eyes. The botched surgery was performed in an illegal clinic with no medical equipment and without anesthesia. After this, Rodrigo had to receive corrective surgeries in other hospitals to fix his nose, lips, and eyes. He also sued the doctor and received a settlement of $200,000. Sadly, this wasn't the only time a doctor tried to turn a person into a man by stitching their face inside out. In 2008, a Chinese man underwent an operation to reshape his face. But the surgeon cut too much skin away, leaving him with only a thin sheet of skin covering his cheekbones. As a result, the patient was left looking like a skeleton. A young boy had to have sulfuric acid put onto his skin to remove a wart. Back in 1974, a 5-year-old kid from West Virginia developed a small wart on his knee. His mother took him to see Dr. Lawrence K. Golden, who treated the child with sulfuric acid. When she returned to pick up her son, the mother was shocked at what had happened to her child. The acid had melted large portions of flesh from the boy's leg, destroying the muscles, nerves, and tendons. After the horrifying treatment, the boy cried out in agony and had to be taken to the hospital. At the hospital, doctors placed the boy in an isolation ward because they didn't want other patients to come into contact with the corrosive substance. Luckily, the boy recovered from the incident and even made a full recovery. However, the doctor who treated him was eventually charged with unlawful wounding and lost his medical license. Medical students carry out an experiment that leaves their hands covered in flesh-melting acid. In 2014, 2 medical students decided to carry out a disgusting science experiment. They poured acid onto their bare hands and then immediately regretted it. The experiment was meant to show how long it takes for acid to dissolve human skin. The pair planned to document the entire thing on camera, but thankfully never released the footage to the public. Instead, they uploaded a photo of themselves online, showing their hands covered in gooey flesh. To neutralize the corrosive acid, they had to cover their hands in baking soda, which is a chemical base. They say that the pain felt like a combination of sunburn and second-degree burns. Both of them suffered damaged skin and peeling flesh. But perhaps the worst part was the stench that followed them around for weeks. Even though their experiment was over, the smell lingered on and clung to their clothes, hair, and skin. Doctors fed live frogs to a patient to cure his stomach cancer. In 1858, a man suffering from stomach cancer visited the Institute of Experimental Medicine in Paris. He wanted to enroll in a clinical trial for a new experimental treatment. He agreed to eat a mixture of ground-up toads, salamanders, and live frogs to fight his disease. According to the doctor, the man ate a total of 20 live frogs, but he couldn't tolerate the taste or texture of the amphibians. He started to vomit and became violently ill after each dose. On the 4th day of the experiment, he suffered a seizure and died. An autopsy showed that his stomach was perforated. The frogs had caused a hole to develop in his stomach lining. This led to bacteria and other substances leaking into his abdominal cavity. When the bacteria entered his bloodstream, it triggered a fatal infection. His death was so horrific that the doctors continued to study his corpse. They wanted to find out if the frog meat remained toxic after cooking. In another case of cannibalism experiments, a woman was given a drink made of a baby's heart and liver. The experiment was carried out in 1908. A 34-year-old woman went to a hospital in Philadelphia with severe abdominal pain. She had an appendix blockage and needed urgent surgery. But the attending surgeon, Dr. Thaddeus Airy, had other plans. He removed the woman's appendix, but he also gave her an experimental sedative, which was prepared with a mixture of extracts from a monkey, a dog, a chicken, and a baby. The drink contained pieces of the baby's heart and liver. This was supposed to help the woman calm down and feel less pain. Tragically, the sedative killed her. During the First World War, soldiers were exposed to mustard gas, a powerful burning agent that blistered and burned the skin. If a soldier was exposed to a high concentration of the substance, they would go blind and die within a few minutes. In order to help injured soldiers cope with mustard gas, doctors injected them with the urine of cats that had been repeatedly exposed to the gas. It was believed that the cat urine would immunize the soldiers against the effects of mustard gas. However, the treatment proved to be ineffective and even dangerous. Cat urine contains sodium and other chemicals that can burn the skin and cause severe blisters. Army medics in World War II decided to use leeches to treat wounded soldiers. Leeches were widely used in the 19th century to treat all kinds of illnesses and injuries. During World War II, Army medics thought that they could help reanimate dead soldiers by inserting leeches into their bodies. Despite the fact that the soldiers were already dead, the leeches would suck the blood out of their corpses, helping to restore circulation. Of course, this didn't bring the soldiers back to life, but it did help medics transport the corpses. Now it's time to make your voice heard. Comment below which of these treatments you found the most insane. Don't forget to subscribe.